Hello, sir.
Yeah, I can hear
Yeah.
you.
All right, sir. The voice is better now. We can start.
Better now?
Yes, yes.
Yeah. Okay, so this is 30 minutes talk, right?
Yes, sir.
30 minutes. Okay. So thank you for the opportunity. Now I will present my lecture. This is regarding preoperative preparation and materials required for rhinoplasty. Successful rhinoplasty begins with careful patient selection, preoperative preparation, and planning. So why preparation? Preparation will give you peace of mind because you will be knowing what you are doing and what are the requirements for the rhinoplasty and what materials you want and what are the other prerequisites. So everything you should well in advance you have to prepare yourself. You must know there is a steep learning curve in rhinoplasty practice. So you must know where you stand. So don't be overconfident. You must know whether you are a beginner or you have done few septoplasties or some you have done some functional rhinoplasty or something like that. So you have to select the case depending upon your expertise. Patient selection is also important preparation. It's a very challenging task for any rhinoplasty surgeon. Any individual is a potentially rhinoplasty case because when you see any nose, you will find out some deformity in the nose as a rhinoplasty surgeon. But patient has to come for rhinoplasty. Okay, the age is controversial, so usually we do rhinoplasty after 18 years, 16 to 17 years, depending upon the requirement. If the patient is having minor deformity, imaginary defect, body dysmorphic disorder, or motivated by others, then these patients are not good patients for rhinoplasty. Okay, even the revision case also sometimes patient may not be happy with your results. Some of the difficult cases like reconstruction of the nose, if the patient is having a facial asymmetry, post-septal abscess, major septal perforations, cleft nose, all these cases are difficult cases. When you get these kind of patients, be careful while you select the patient. If you need any help from the other surgeon or senior surgeon, take help of the senior surgeon. And one more point I want to add, if the patient is having any epilepsy kind of history, then you have to take care post-operatively. They may throw seizures in the post-operative period. If the patients are clear cut with their requirement, expectation, then it is easy for any rhinoplasty surgeon. In this case, see, there is a hump in the nose, tip drooping is there. So these kind of cases are simple and clear cut cases. You can operate and you can give good results to these patients. Deviated nose, you can correct it by doing osteotomies and patients will be happy. Deviated nose, hump nose. These cases are clear-cut cases. So while selecting the case, you are going to you can be sure that patient will be happy after the surgery. Okay, so sometimes it is not enough to do what is our best. We must do what is required to the patient. You cannot do whatever you want. The surgery is patient centric, not the doctor centric. Okay. You all know the rhinoplasty is art and science. It is a skill. You have to be very smart enough to have a consultation with the patient. You must know the expectations of the patient. They may need augmentation, reduction, deviation, something like that. It will come by experience. And rhinoplasty is a teamwork. Not a surgeon alone can do these kind of a work. You have to have a you have to team up with your anesthetist, your assistants, and you must have proper surgical instruments. And you must know the surgical techniques. You have to learn with passion, and then only you can enjoy the work. So why preparation? So why, what is the goal of preparation? The preparation before surgery is helpful to avoid complications and you can give good results. Preparations will give better post-operative satisfaction to the patient. Surgeon anesthetists are also stress-free when you prepare well. OT staffs and hospital staffs are also comfortable during the surgery because they know what is going on. Patient attenders are also mentally prepared and they are aware of the procedure, then they will be comfortable in the ward. As a surgeon, what are the precautions or preparations you have to take? You must identify the patient and you have to take fitness from the physician and anesthetist. If you are doing multiple cases, then identity is a medical legal issue. Okay, so you have to identify properly and you have to take photographs, preoperative photographs, and ask the patient three expectations, main expectations like deviated nose correction, nose block correction, or plasty, something like that. So at least you have to ask three main expectations from the patient. And while taking history, you have to ask for previous hospital admission, previous nose surgery. Sometimes they would have done septoplasty, something else. You may not get uh, okay, so the patient may not disclose the previous hospital admission and previous history. You have to take consent for the surgery, consent for public display and academic presentation. Cost of the procedure also you have to discuss with the patient attendants well in advance to avoid confusion after surgery, and you have to inform all the dates, post-operative dates, post-operative follow-up dates with the patient. Okay. Okay, next slide. Next slide. I want to go to next slide and it's not going. Yeah. I'm not able to go to the next slide. Can I go to next slide? I'm not able to go to the next slide. Hello. I'll go to the next slide. Hello. Can you hear me? Hello. Hello.
Yes, sir, we can hear you.
Yeah, the next slide. Okay, this is the next slide. Yeah, preoperative preparation of a surgeon in the you have to take consent, and then you have to discuss with the cost the patient attenders the cost of the procedure, and you have to inform post-op follow-up dates with the patient attenders. Okay, next slide. Okay, next slide. This is the photograph. This is the picture showing the photographs, the different views. This is the profile view, and this is the aerial view, and this is a lateral view, right and left side, and then oblique view. So you will come to know the different deformities or different framework problems with the nose, and you can discuss with the patient what are the requirement of the patient. Preoperative preparation of a surgeon in operation room. So one must have sterile rhinoplasty instrument, at least two sets if you are doing multiple cases in a day. Uh, and you must keep ready the rib harvesting set, the consumables like sutures, splints, nasal bags, headlight with or without loop, extra batteries. All these things are important as a rhinoplasty surgeon. Don't depend on anybody. You have to have your own headlight. And if possible, better to have three assistants, floor staff, two trolleys to keep all the instruments. Agent should of the patient should be free. Okay, and you have to imagine the surgery steps before you start the case, and you must discuss with your assistants. Discuss with your assistant, inform your assistant that what you are going to do to this patient. The next is surgical step. So you must, well in advance, you have to imagine the surgical steps in your mind and then operate on the patient. You may have to do a closed approach or open approach or type of incision or other facial plastic procedures. You must know the chronology of the surgical step to eat when you plan the surgery. The chronology you must keep in your mind. Always you have to do in an order like flap elevation, dorsal reduction, septal cartilage harvesting, septal deviation correction, osteotomies. So when to do osteotomies, before tiplasty or after tiplasty, all these things you must know. And at the end, we do alar reduction. If you want to do the alar base reduction, you can do it after the suturing of the columnar suturing, and then you can do other packing and dressing. Preoperative preparation of an anesthetist. So this is also important. You must talk to the anesthetist. If possible, you keep your anesthetist, same anesthetist in your hospital. Whenever you post a rhinoplasty case, the same anesthetist should come and help you out. He has to do a pre-anesthetic checkup. He has to look for the weight and the vitals, coagulation profile. Always ask the anesthetist to put South Pole RAE tube for oral intubation. Check the cuff before intubating, and then always better to have a head ring and protect the eyes and ears, and ask the anesthetist to give smooth extubation. So this is the picture showing the OT, the ergonomics. You can see the patient is lying down on the table, and anesthetist is intubating. All the other equipments like endoscopic camera, trolley, pulse operators, all should be on the left side of the patient. So the right side of the patient should be free. So you can stand here as a surgeon, and the assistants, the first assistant at the head end, and the left side you will have a second assistant, and the scrub nurse will be standing somewhere here. Okay, this is one more picture showing the head end is free. You can utilize this space in the OT. You can keep your trolleys, and you can operate with whatever desirable space. So you have to prepare the patient preoperatively. What are the things you must tell the patient and patient attenders? You must tell the patient, and the patient must understand the procedure. You must share the dates of the events in advance, like when you are going to operate, how many days you have to stay in the hospital, how many days after surgery you have to come for suture removal, all those things. And you must you have to prepare the patient, and you must know the patient must know the healing process of the surgery. At least 3 months, 6 months, 3 weeks to 6 weeks to 3 months for complete results. You must tell the patient that the results will take time. Okay, soon after splint removal, patient may come and ask you. They may not be happy with the shape of the nose because of the swelling or edema. Okay, and you have to prepare the face, trim the hairs, facial hairs, ask the patient to go for head bath because after surgery she may not able to go for head bath, and you have to empty the bowel and bladder before shifting the patient. And you can see the picture here. The girls or ladies should have two braids for female before shifting the patient to operation room, because if the patient's having head more hairs, the head may not sit in the desirable position. Okay, and you have to have your own surgical instruments. You have to keep good nasal speculums, scissors, retractors, suction tips, osteotomes, cartilage forceps, needle holders, rasp, and rib cartilage harvesting instruments. What are the materials required for rhinoplasty? You must have good syringes to infiltrate the nose, nasal septum or nasal framework. 26 gauge offit needle to stabilize the suture, those needles to keep the cartilage in desirable position before suturing. Number 11 blade, number 15 blade, and the sutures like 50 PDS, 50 Vicryl, 50 Prolene, and 30 Prolene. Internal nasal splint, nasal packs, external nasal splints. Okay, and then tincture benjoin. All these are important materials for rhinoplasty. One must keep all these materials whenever you go to a different place, whenever you go to when you operate in a different hospital. Sometimes you may not get all these materials, so it is always better to keep the materials along with you whenever you go to surgery. So always you tell the pharmacist the number. This is the code number W9872 for PDS. 50 is the NW862. These are the codes you have to discuss. You have to tell the pharmacist or the nursing staff to keep the sutures ready. Okay, next coming to the post-operative care. You have to prepare the nursing staff in the post-operative ward about the pain management, antibiotics, IV antibiotics, and the periorbital edema. You must prepare well in advance the patients and patient attenders and nursing staff about the swelling around the eyes, and when we are going to remove the pack, when we are going to remove the sutures, when we are going to clean the nose. All these things you have to inform well in advance to the patient attenders, and the nursing staff. Okay. So to summarize, you must prepare yourself. You have to prepare others also. Don't blame others if you don't have anything, like some suture is not there. You cannot blame others. It is your responsibility as a rhinoplasty surgeon. So you must have free anesthetic evaluation, physician opinion for the fitness. You must get ready the operation room. You must inform the anesthetist. You have to inform the assistants, and you have to have your own sterile instruments and suture materials, whatever consumables required. You must have your own headlight. Okay. What is the take home message? You must do the surgery with passion and compassion. You have to take care of your patient before surgery, during surgery, and after surgery. As a surgeon, you must be fit enough to operate for 4 to 6 hours or 10 hours a day. So you have to be active. And if you are doing other ENT practice or other practice, you have to practice both. If you cannot be busy with rhinoplasty because it is a narrow field, you may not get busy with only rhinoplasty work. And case selection is important. You have to have you must know whether you are going to give good result with the patient to the patient or not. Then only you select the patient and operate. Pre-operative preparation, surgical steps, post-operative care, everything should be well in advance. You have to inform the patients and patient attenders and the nursing staff. Okay. So thank you. My presentation is over. This is our workshop. We are conducting Rhinoplasty Bangalore 2023 International Live Surgical Workshop in the month of July, 1st and 2nd. So Dr. Jung Dong Hak is coming as a guest speaker. So those who are interested can contact me. So we will have we'll have academic fees there. Okay. Thank you.
Thank you so much, sir. Thank you so much, sir.
Hope the presentation was clear and audible. I don't
Yes,
know.
sir. Yes, sir. We all enjoyed your lecture.
Yeah. If any, please tell me the feedback. Any issue with the presentation or any
No, sir. No,
audio
sir.
visual?
No, sir. No issues.
Okay. So
Thank you, sir.
any question and answer session is there? Hello.
Chidananda, Dr. Basir here.
Good morning, sir. Sorry,
morning.
I have to take your permission.
I was listening to your lecture.
Workshop.
Yeah.
Hello.
There is a gentleman from Egypt, and he's asking a question that you have discussed something, but intraoperatively you have to decide some changes or some steps which you need to do out. So, any comments about that? How to do it? Because you didn't thought about it preoperatively, but intraoperatively you thought that.
Intraoperatively, any changes? Yeah, if you are on table, if you feel you need some changes, then you can change your decision. You can change your decision and you can do the. I didn't get your question, sir.
It says that if you're not discussed with the patient before operation, but if you need during surgery, you feel the need of doing some modification or some steps which were not discussed with the patient. So
Okay.
how
Okay, I got
are
it.
you justified to
We
do
have
that?
to. Yeah, I got your question. We have to discuss with the patient attender because patient will be intubated. We have to discuss with the patient attender whether we have to do it or not. We have to take consent from the patient attender.
Thank you, Chidananda. It's a wonderful lecture. We enjoyed, and best of luck for your conference. And
Thank you, sir. Thank you, sir. Thank you so much.
we'll have a next lecture in the OT only.
Okay.